Good afternoon. Good afternoon, Senate Finance and our few guests. You should have in front of you voting list number 25 dated Friday, March 31st. We have a number of bills that we will take up this afternoon, and we do not expect this to be a terribly lengthy voting session. Who's going to start first? We're going to start with David's bills on the yellow packet in front of you. Good afternoon, David.
Okay. The first bill on your list is House Bill 111. It's a cross file to Senate Bill 26. And if you remember, the bill requires the Maryland Department of Health, subject to the limitations of the state budget and as permitted by federal law, to establish an express lane eligibility program with a focus on redetermination of continued eligibility for individuals already enrolled in Medicaid and CHIP programs based on eligibility findings under the Supplemental Nutrition Assistance Program. The bill is largely identical to House Bill 111 is largely identical to Senate Bill 26, which did pass the Senate unanimously. The only difference is, and there's a amendment in front of you, to add a study to allow this. There was a language amended onto the bill, which really has nothing to do with anything in the bill, but it allows this group studying low-income utility assistance to continue their work. That was put onto the Senate bill. The House will not have a problem if you amend this bill to conform to the Senate bill that's over there right now.
Move favorable with amendment.
Have a motion and a second for a favorable with amendments, House Bill 111. Seeing no questions, all those in favor, raise your hand. Seeing no opposition, that bill receives a unanimous favorable with amendments. Next bill.
The next bill is House Bill 246. It's a cross file to Senate Bill 322, which also unanimously passed the Senate. However, there are some differences here. I don't know if you want to describe the bill or just to hold the bill for now.
Please. Okay, Senator Bidel requests to hold, so we'll hold House Bill 246 for the purposes of reviewing the amendments. Thank you. Next bill.
The next bill is House Bill 565. This is very similar to Senate Bill 431, which also unanimously passed the Senate. It authorizes a holder of a Class 9 limited distillery license to apply and obtain a Class 8 liquor wholesaler's license. The House, who has been doing alcoholic beverage bills far longer than us, had some tweaks to the bill to make it more technically accurate. So they'll probably amend the Senate bill to look like this bill, and it'd be best to pass this bill in the same form as it came across without amendments.
Move favorable.
Have a motion and a second for a favorable on House Bill 565. That was without amendment.
Without amendments.
Now, are there any questions? All those in favor, raise your hand. That bill receives a unanimous favorable report. Next bill.
Next bill is House Bill 614. This is the long-term care and dementia care navigator programs. Long-term care was added by amendment. House Bill 614 is similar to Senate Bill 228, which unanimously also passed the Senate. The bill requires each area agency on aging, subject to the limitations of funding provided. And that's an amendment that was put in on the House in the bill, which you have in front of you, to develop a long-term care and dementia care navigation program that consists of new or existing services. The bill includes a mandated appropriation, and funding from the mandated appropriation must be distributed amongst the local areas on aging proportionally to each AAA based on a formula that considers the number of individuals who will need care. These two amendments are different. That language is different than what the Senate sent over. These were the amendments from Montgomery County, which you said you would address when the House bill came over. So if you want to keep the Montgomery County amendments in here, then you pass this clean, and then you'll have identical bills because the House will do the same thing to the Senate bill. And Senator Bidel is the sponsor. Yeah.
Okay, so this is a bill that is a cross-file of Senator Bidel's bill that we passed a while back to provide services through local area on aging services for people who are in need of dementia or other
Long-term care
long-term
services.
care services.
It'd be.
And I have a motion, but I don't, thank you. I have a motion and a second. I was stalling. Motion and a second for a favorable on 614. House Bill 614 as
No,
not amended, as sent over from the House. Any questions? All those in favor, raise your hand. That bill receives a unanimous favorable report. Next bill.
okay, the next bill is House Bill 626. It's a cross file to Senate Bills 560. They're largely the same. The bill, if you recall, the bill requires research facilities that conduct research using non-human animals to make a payment to the Maryland Department of Health each year based on the number of animals used in their research. The Secretary of Health must then distribute the revenues to the Human Relevant Research Fund to promote state-funded research intended to develop human relevant alternatives. This bill this had some opposition on the Senate floor and in committee, I believe. But there's an amendment in front of you, which is purely technical, and I passed that out. It just changes a word in it changes the purpose paragraph to conform to what the bill actually does.
Well, this was Senator Gazzone's.
This was Senator, yes.
Move favorable.
Motion and a second for a favorable on whatever bill that was. House Bill 626.
Favorable with amendment.
Seeing no questions, all those in favor, raise your hand. Okay, let me do
No,
a
you
count.
voted against
Okay.
it.
Those opposed, raise your hand. That's 3. So that's 8-3. That bill receives a favorable report. Next bill.
The next bill is a local bill, House bill. There's no cross file to this one. And I've got the wrong folder in front of me. Okay, did I miss one here? Okay, no, we didn't get to that one yet. Okay, sorry. I just had my folders in the wrong order. The next bill is a local bill, House Bill 763. It's from Montgomery County. That it alters the statutory provisions regarding the collective bargaining process for sheriff's office employees in Montgomery County to specify that if the sheriff and the bargaining representative are unable to reach an agreement during negotiations applicable to their offices, the procedures for declaring an impasse and submission of a dispute for binding arbitration would be required or established. The bill is supported by the Montgomery County Senate delegation.
Do we have a letter?
Yes, we had at the hearing and we had the chair of the delegation presenting the bill. You said sponsor problems?
You know, that hurt.
Is this in cycle or out of cycle?
This is actually.
Senator Mount, very
He's
good.
on a roll.
Nobody else gets it.
They weren't here.
All right, so we have House Bill 763 before us, and I heard a motion and a second. Any questions? All those in favor, raise your hand on 763. That bill receives a unanimous favorable report. Next bill.
The next bill is House Bill 764, also from Montgomery County. This is the in-cycle bill or out-cycle bill. It's a local bill that authorizes the appointment of a mediator arbitrator during the term of a collective bargaining agreement of the Montgomery County Housing Opportunities Commission during the term of the collective bargaining agreement. It also establishes the powers and responsibilities of the mediator arbitrator. It has the support of the county Senate delegation we have a letter.
Move favorable.
Motion and a second for a favorable on House Bill 764. Seeing no questions, all those in favor, raise your hand. That bill receives a unanimous favorable report. Next bill.
Next bill is House Bill 907. This is not a cross-filed bill. It authorizes a landlord or property owner or any other agent who represents a landlord or property owner to enter into a contract with a different licensed elevator contractor other than the one with whom these folks have a contract without penalty to effectuate an urgent repair. This authorization would only apply if the elevator is out of service, it is located in a residential occupancy in which a disabled occupant or occupant who is at least 60 years old resides, and the new contractor is able to repair the elevator before the current contractor can get to the job. There was no opposition to this bill.
Senator Reedy.
So was looking at this, and because we've had a lot of talk about elevators this session, I'm confused as to You mean that you wouldn't be able to just go get somebody to fix the elevator if it's broken or?
As the industry works, you're under contract with certain elevator contractors to maintain your elevators. Apparently during COVID, somebody had a problem in a multi-family building and folks couldn't use the elevators, and the one they were under contract with couldn't come and service the elevators. So this would allow an out from that particular contract clause if that is the case, and only in these specific circumstances, they go outside the contract and bringing somebody out without getting a penalty under the contract they're under.
I must have missed the hearing because we're all going back and forth to different committees right now in this period of it. I don't understand. I get that argument, but at the same time, if this happened during COVID, it was partly probably stupid government regulations that may have made this happen. And now we're going to just change the law and go into people's contracts because one guy's going to take a week or two longer to get to something. Or I know it says if there's disabled people, which seems important, but I would think that the companies now are, I'm just not comfortable, I don't know, meddling to this extent with local contract, with like private company contracts. That's just my opinion.
No, I think those are good questions. And if other people that were at the hearing want to weigh in, what I heard at the hearing is, and I'd never heard of anything like this before, that people have a contract with a company. And if that company's not available and they use another company, they have to buy out the rest of their contract with the original company. And so there were people who were in facilities or houses that were stranded basically and needed to use another company, but they couldn't without experiencing a financial loss. And so this bill seeks to say, under those circumstances, you can use somebody else and not have to buy out your original contract. And Senator Kramer has his light on, so maybe he wants to add something or add something to the discussion.
Yeah, no, thank you, Madam Chair. I think you did clarify the issue. I think it's under very limited circumstances that this bill would be applicable, but also knowing the industry, particularly with residential buildings, this could be a real hardship for elderly residents who don't have access to an elevator and find themselves where, whether it's COVID or not, they need a quick repair of an elevator, and one company might be available with their technicians. There aren't a whole lot of folks in this space doing this work. So I can understand that this might fill a void that exists right now. So thank you.
Thank you. We'll go Senator Mounts, then Senator Hershey, Senator Guile.
Just a quick question. Was there any oral opposition testimony, and there was no written opposition testimony? Okay, thank you.
Yeah, thank you, Madam Chair. I mean, my concern is that maintenance contracts are written just for that purpose, to be out there and to be available to fix and repair as needed. Now, there could have been circumstances that occurred that maybe they were not able to get out there as quickly as possible. But I think that there are always ways to circumvent that in the real world without having to come to the legislature to have policy changed as a result of that. I also wonder if there was any testimony based on warranties. So for instance, if you are maybe the installer of this elevator equipment, and maybe you do have the service maintenance contract, could it possibly having somebody else come in and do this work because we've passed some legislation void a warranty? And so I just think that this is, again, I'm not a big fan of, this one-off, hey, one circumstance happened and all of a sudden we got to create policy for it. It just concerns me that we're kind of possibly doing the old camel nose under the tent and getting to a position where we see this happen with other maintenance contracts. So thank you.
Thank you. Senator Guile.
Thank you, Madam Chair. It's a good discussion. I mean, I also feel have a little pause at times when I think of disrupting what two equal parties have bargained for in a contract. On the other hand, we have also even just this session made a decision that as a matter of public policy, that there's a couple instances where we would void some certain terms of a contract, for example, waiver of liability, like at jump facilities or, well, you know, I can't remember exactly what the most recent bill was, but where you can't waive certain liability claims. We also, I mean, I had a bill about protecting tenants from clauses where you can't evict a tenant for calling 911. So I think that we can also say, though, that as a matter of policy, though, that we for public health, we want to be able to make sure people get out. And I don't think I agree that there were some things that were really you know, specific to this this time period, the pandemic that we were in. I don't think it was necessarily government regulations, in as much as maybe people were just sick and couldn't get out to repair the elevators at that time period. And I don't think that it's beyond any sort of stretch of imagination that an instance like this wouldn't occur sometime in the future. If some business, you know, went like, you know, I was struggling with business, you know, problems and wasn't able to get out to fix an elevator, that you got to be able to get it fixed. So, I mean, and I think to Senator Hershey's point, I mean, certainly there could be other ramifications that would arise from like a breach of contract by saying that they couldn't come out. But I do think though, for health reasons, for safety reasons, that that we can consider that these are, you know, void as a matter of public policy. So those are my thoughts on it. Thank you, Madam Chair.
Thank you, Senator. Vice Chair?
Yeah, I think part of the whole situation was the one company couldn't get the parts. Does anybody remember that? And and because of the situation, it went on and on and on, and they just couldn't get people out. So, and it doesn't even have to be an older person. It could have been a child in a wheelchair. So anyway, that's what I have to say, but I would like to hold this bill, I think.
Okay, we're gonna hold this. We're gonna hold this, and it sounds like there's potential unintended consequences, but we'll see what we can find out by our next voting session.
Okay.
Next bill?
The next bill on your list is House Bill 922. It's again very similar to Senate Bill 525, which passed the Senate unanimously. The bill prohibits the Department of Commerce from denying licensed cannabis businesses economic development and financial assistance program benefits solely because they are a cannabis business. The difference between the House and the Senate bill is you amended the Senate bill to reauthorize these folks to apply for these licenses if they were rejected. My understanding is the House has approved the Senate bill with this amendment. So if you wish to conform and have identical bills, you would conform the House bill to the Senate bill.
Second.
Have a motion and a second to conform the House bill to the posture that the Senate bill was passed. Any questions? All those in favor, raise your hand. That bill receives a unanimous, did Reedy raise his hand? Okay, unanimous favorable report. Next bill.
Okay, the next bill is a local alcohol bill. Yes. It clarifies that the holder of a Class B BWL in parentheses clubhouse/lodge license in Montgomery County that is issued to a Class 7 microbrewery license is not subject to the general licensure restrictions on holders of Class 7 microbrewery licenses. The bill is supported by the Montgomery County Senate delegation. We have a letter. There are no amendments.
Move favorable.
Second.
Have a motion and a second for a favorable on House Bill 277. Any questions? All those in favor, raise your hand. That bill receives a unanimous favorable report. Next bill.
The next bill is House Bill 345, also from Montgomery County. It's a local bill that alters the membership of the Montgomery County Alcohol Beverage Services Advisory Board to allow designees of the directors of the board and to Montgomery County Police Department. Again, the bill is supported by the Montgomery County Senate delegation via letter.
Favorable.
Motion and second for a favorable on House Bill 345. Seeing no questions, all those in favor, raise your hand. That bill receives a unanimous favorable report. Next bill.
The next bill is House Bill 436, another local alcohol bill. This one deals with Prince George's County. I think it involves the blue corridor or blue line corridor. It's a local bill that authorizes the Prince George's County Board of License Commissioners to approve the transfer of a Class A beer, wine, and liquor license to a premises located in that designated area of the county if there is no similar license there. The bill also updates the law pertaining to the issuance of a Class 8-DD Development District 7-day beer, wine, and liquor license in the county and establishes an annual license fee of $5,000 for that license. This bill is also supported by the Prince George's County Senate delegation with a letter.
Move favorable. Second.
Motion and a second for a favorable on House Bill 346. Seeing no questions, all those in favor, raise your hand. Unanimous favorable report. Next bill.
Another bill from Prince George's County, alcohol bill. This is House Bill 438. It's a local bill that authorizes Class B stadium, a baseball stadium license holders in Prince George's County to sell liquor in addition to beer and wine for on-premises consumption. It also renames the previous Class B beer, wine, and liquor stadium license as the Class B stadium football stadium license. The bill also specifies that the Prince George's County Board of License Commissioners is authorized to issue one Class B stadium baseball license and one Class B stadium football stadium license. Profits from the sale of beer, wine, or liquor may accrue to either the Maryland National Capital Park and Planning Commission or the concessionaire. The bill is supported with a letter by the Prince George's County Senate delegation.
That's interesting.
Okay, this
Second.
have a motion and a second for a favorable on the Bowie Baysock Stadium license bill. Senator Ellis.
Hey, you said football, it should be baseball, right?
No, well, it said, the way it's described is it authorizes a Class B stadium in Prince George's County to sell liquor. It's baseball license holders to, the bill also renames the Class B wine and liquor stadium as a Class B football stadium. Like, so I think it's either or under the,
Also, that's okay?
Yeah.
Okay.
Okay, I have a motion and a second for a favorable on House Bill 940. Nope, sorry, House Bill 438. Are there any questions? All those in favor, raise your hand. That bill receives a unanimous favorable report. We'll move to the next bill.
another Prince George's County alcohol bill. It's House Bill 946, local bill that authorizes the County Board of License Commissioners to issue up to 5 Class 8-DD, and that's Development District licenses to restaurants located within Main Street Laurel from Washington Boulevard to 7th Street between the Pawtuxet River to the north and Prince George Street to the south. The bill is supported by letter from the Prince George's County Senate delegation.
Have a motion and a second for a favorable on House Bill 946. Are there any questions? All those in favor, raise your hand. That bill receives a unanimous favorable report. Next bill.
The next bill is 760, Senate Bill 767. You are second on this bill. This is bill, the primary committee was judicial proceedings and they voted unfavorable on this bill, and you're asked for your concurrence on this, and Senator Reedy attended the hearing on this bill. Do you want me to describe it? Yes. No.
Quite a hearing, and I think the Judicial Proceedings Committee acted very wisely in putting this bill out of its giving this bill some time to think about this issue maybe for next year. I would move unfavorable, Madam Chair.
Have a motion and a second on the unfavorable. All those in favor, raise your hand. That bill is unanimously unfavorable. Okay.
Okay.
Next bill.
The next bill on your list is Senate Bill 696. This is a local bill that establishes the print.
just pause one second?
Certainly.
You were in favor of the unfavorable, right? Or you
No,
were?
I was
Okay.
not supporting.
Okay, so that was 10 on the unfavorable, 1 in opposition to the unfavorable. Right, so that bill was not unanimous. That was a 10-1 vote. Thank you for the clarification. We need somebody to raise a hand and make noise when they're done.
Where's your hand? Yeah.
Okay, hang on. Go ahead, Senator Ellis.
So could I change my vote with?
You would like to
Yes.
also, so that
Yes,
it's not going to change the outcome.
Right.
That is fine. So it's now 9-2. Is there any additional
you.
vote change recommendation?
Uh,
All right, that bill is still unfavorable with a 9-2 vote.
Okay.
Now we'll move on to the next bill.
Okay, again, we're back to Senate Bill 696. This is a local Prince George's County bill regarding the Gateway Arts Development Authority, and I believe the chair has a few words here.
Yeah, colleagues, this bill came in, it came in a long time ago, and I actually thought we had voted it out. I told the sponsor we had voted out, and I can almost remember us voting it out, but there is no record of us having voted for this bill. But it did receive a favorable support of the Prince George's delegation. Basically, it establishes a district in that Gateway Arts area of Prince George's County where the sponsor has built community support around this. And so I would ask for a motion.
There's an amendment.
Oh, I'm sorry, I
Which
forgot the
it-
amendment.
The House bill is over here in the Rules Committee, and there's an amendment that removes members of the General Assembly from the authority. So the amendment would conform it to the House bill that's over here in a different another committee.
And there was also an amendment that should have come with the bill as introduced to take the name arts out of the title
It
of
does.
this development authority because there is a Gateway Arts something else, and we wanted there not to be confusion. So we took the arts out of that title in the delegation.
That's in the reprint in front of you also.
Have a motion and a second for a favorable on Senate Bill 696 as amended. Seeing no questions, all those in favor, raise your hand. That bill receives a unanimous favorable report. We'll go to the next bill. And
Patrick.
oops, that's in David, thank you. We'll go to Patrick. And send Nathan, if you're listening, we send our regards and hope you're doing well. We got one of yours through without you. But hurry back.
House Bill 214 is the next bill on the voting list. This is the bill that establishes the Commission on Public Health to make recommendations to improve the delivery of foundational public health services in the state. The commission must assess the foundational public health capabilities of the Maryland Department of Health and local health departments. There is a reprint in front of you that shows some amendments that the chair would offer on this bill, and I can walk through the bill and highlight the chair's amendments, and then I think Senator Lamb will have some amendments that he'll offer for consideration. So as I mentioned, the purpose of this commission is to make recommendations to improve the delivery of the foundational public health services in the state. So if you go to page 2 of the bill, you can see what foundational public health services would include: communicable disease control, chronic disease and injury prevention, environmental public health, maternal child, family health, access to and linkage with clinical care. And then there are listed some foundational capabilities. You can see assessment and surveillance, organizational competencies, equity. Some other things are listed here. Starting on page 3, the membership of the commission is listed. It would include, I think, between 12 and 14 members is contemplated here. Various officials within the health department, the deputy secretary of public health or designee, deputy secretary of behavioral health or designee, director of the Office of Minority Health and Health Disparities or designee. Then there are certain members who are appointed by the governor, 3 local health officers, one of whom being from a rural jurisdiction, one from a suburban jurisdiction, one from an urban jurisdiction. There would be 2 representatives from state academic institutions with expertise in public health systems, so think University of Maryland or Johns Hopkins School of Public Health. There would be a faculty member from a public health program at a historically Black college or university. And then on page 4, at least 3, but not more than 5 members of the public would demonstrate an interest in public health and experience in at least one of the following areas listed here: health equity, IT, workforce, population health. The House, as they pass the bill out with their amendments, would require the commission to consult with certain agencies listed here as necessary, such as the Healthcare Commission, the HSCRC, Community Health Resources Commission, Department of Budget and Management, and so forth. Any other state agency is appropriate. So this is not an exhaustive list. Then the commission would be required to establish certain work groups, and those work groups would be directed to the following topics: funding, governance and organizational capabilities, workforce, data and information technology, and communication and public engagement. There's certain membership specified for the work groups that they have to include a couple members of the commission and then members of the public with relevant experience in the subject matter of the work group, who may include individuals from these types of groups. So the first amendment that the chair is offering would add to this list of work group members individuals from representing faith-based organizations. And the purpose of the work groups is to foster broad engagement, provide expertise for the purpose of informing the work and recommendations of the commission. And to the extent practicable and consistent with state and federal law, the membership of the commission and work groups must reflect the racial, ethnic, and gender diversity of the state. On page 6, here's the second amendment that the chair is offering. Instead of, and this is relating to who's going to chair the commission. So the way that the bill is the House is sent over, the co-chairs of the commission would come from the academic institutions. So it's the members who are coming from those academic institutions. And instead of just having the co-chairs be these members from the academic institutions, the amendment would have the public health expert member from the HBCU also co-chair the commission along with these individuals. The way that the staffing has it, I think I jumped the gun here. Oh, no, the way the House has the staffing is that the academic institutions would provide staff support for the commission. Some of the specific duties of the commission is listed here on the bottom of page 6 to assess the foundational public health capabilities of the department and local health departments. In conducting this assessment, this commission must explain the impact of the foundational public health capabilities on the state's ability to address foundational public health areas, explain the impact of the foundational public health capabilities on the state's ability to respond to COVID-19, overdoses, maternal and infant mortality, and other major, okay, all right, okay. So the third amendment would authorize the commission to request de-identified and publicly available data instead of authorizing them to request and obtain data. So it tightens it up there. And then you can see here the recommendations in certain areas that this group is supposed to make. I think that's covers the essence of it. There's an interim report required at the end of 2023, and then there's a final report required in 2024.
Okay, so I have a motion and a second for a favorable on the reprint with amendments, but Senator Lamb wanted to offer some alternative amendments. So I wanted to give him an opportunity to present those.
Thank you, Madam Chair, and to the committee. So I'm the Senate sponsor of this cross-file bill, and it's taken me a little while to clear up some of the staffing issues, which I'll touch on in a second. So I apologize. We've been kind of working in parallel, and so my amendments kind of came in a little bit after your amendments. But the bill you've heard from Patrick, there are two main differences between these two amendments. So one pertains to the chair, or the co-chairs rather. So In both these versions, there will be 3 co-chairs. The version that you just heard has the 3 co-chairs being the 3 members of the academic institutions of the state, one of which is an HBCU. What I'm proposing in these amendments is 2 out of the 3 institutions would serve as 2 of the 3 co-chairs. And then you would bring in 1 other co-chair to make it a total of 3, who would be a local health officer. And I have spoken with Larry Polsky, who is with the Maryland Association of County Health Officers. They are open to that. He's actually willing to serve if they select him as the health officer representative on the co-chair for the co-chair role. So it would still have 3 co-chairs. It would be the 2 out of the 3 academic institutions that still could be one of the HBCUs. I guess it's only one HBCU that has a school of public health here. It's just Morgan State. But 2 out of the 3 co-chairs would be academic institutions. 1 would be coming as a local health officer. I think it is important to have kind of that local health connection. When I spoke with the secretary, she was open to having a local health officer. She actually suggested this. It's helpful to have somebody who's more familiar on the ground with what's going on with state and local health, and who's actually practicing kind of state and local health. As I mentioned, the county health officers are okay, and it also gives it a little bit more diversity, so it's not just academics participating as the co-chairs. The other main difference is with staffing the commission. The House bill as it came over had staffing volunteered from the schools of public health. I had some reservations about that just because I think it's for a commission of this caliber, you really need folks that are dedicated to this effort. And my concern is that when you pull in volunteer folks to staff a commission of this caliber, you may not get the level of effort that you really need to be able to look at some really important issues for the state. And so I've been working with Vicki Gruber to see if we can find alternative staffing methods to be able to help this commission. And we met with the HSCRC, MHCC, the Community Health Resources Commission, went around a few times, and that's what took a while. But Vicki is now comfortable with providing some of the staffing support for this. And the department will also be supporting this as well. I think it's important to have kind of that connection back to the department because they're going to be providing a lot of information, really have kind of a liaison to be able to supply some of that, on the ground of what's going on at MDH back to the commission. The final 2 smaller amendments that are in the version that you see from me are the addition of a senator and a delegate. I think it's also important to have kind of perspective on what's going on here in Annapolis with the legislation that's being considered, and also being able to have continuity with what comes out of that report, maybe needs for resources, funding, future support, and the like. And the reports are coming back to the General Assembly, so I think it's important to have a link from the recommendations back to potential legislation that might come in the future. Vicki also suggested if we were going to have DLS's involvement, to make the work groups optional. So rather than mandating the work groups, giving them a little bit more flexibility if the commission decides that they don't need all these work groups. If they're mandated, then they have to have them. If it's optional, then they have some more flexibility there. And having the senator and the delegate also makes Vicki a little bit more comfortable so that there's legislative representation on this committee as well.
So basically what you have in front of you, thank you, Senator, are 2 sets of amendments to a bill that do different things to stand up a commission on public health for the state. So basically as it pertains to, let's just take the areas of difference, because there are some areas that are similar, both in the House bill, not both, in the House bill as it came over, and in the amendments that were worked on by me and the chair of HGO, and then by the amendments from Senator Lamb. So the first amendment would pertain to the leadership of the commission. I'm not married to it. In all honesty, the suggestion of having representation from an HBCU that had experience in public health made a lot of sense to me, rather than having two major academic institutions that have kind of a similar sphere of influence and workspace. I thought the addition of an HBCU leader made sense, and so that's why that amendment came out of the meeting with myself and the chair. Senator Lamb's amendment offers a health officer, which further diversifies the leadership of the organization, which isn't necessarily problematic for me, as long as that HBCU representation is still one of the academic leaders and has a strong voice. How HGO will receive Senator Lamb's amendment, I don't know. Senator Hershey, you had a question, comment?
Madam Chair, just along those lines, again, I'm not the biggest fans of academics that are going to try to get together and roll out something that needs to be implemented. I really think that the idea of the health officer is somebody essentially with a boots on the ground type of people that will end up implementing what comes out of this, or have real world experience, not class, academic experience, but really, I think, are out in the forefronts and know what's going on. So I certainly think that that's a good idea, with the health officer being at least one of the three, and however the other two are determined is not as concerning to me.
Okay, so that sounded like a motion by Senator Lamb for the health officer to be one of the three, and a second from Senator Hershey. Any questions or discussions on that amendment? All those in favor? Oh, I'm sorry, Senator Mounts.
Does the amendment include the HBCU?
I don't believe Senator Lamb's amendment does.
It actually could be. So 2 out of the 3 co-chairs would come from 2 out of the 3 schools of public health here in the state. So if
It
the HBCU would like to, they can submit their name to the governor. The other 2 schools of public health could submit the name to the governor. The governor could choose 2 out of those 3.
Yeah, and I just had a thought, which is always dangerous. But how about just incorporate the 2 amendments together and have the 3 and the health officer?
You would have 4 co-chairs, which is almost a commission in
So we could
itself.
do
That'll be a
one
quadro
one
chair.
Traditionally white, one HBCU, one. That's-
It would be a couch. Yeah, that would be a couch. It seats 4.
Okay, so we have a motion and a second on Senator Lamb's amendment that may or may not include an HBCU leader. Are there any questions on that? Further questions or discussion? All those in favor of that amendment, raise your hand. That's 1, 2, 3, 4, 5, 6, 7. Okay, those opposed, raise your hand. 1, 2, 3. Okay, that amendment is adopted. Senator Lamb? Okay.
Why can't there now be a separate amendment to incorporate someone from an HBCU? Why does it have to
There
be one or
can
the other?
be, there can be.
Remove it.
That was where Senator Mounts was going, I think,
Well,
but I
I
think
kinda
he got not a
suspected maybe,
positive
so-
feedback from it, so I decided to wait this process out and see what happened
Is
next.
there an amendment coming? Or did I just?
You just offered
Did I just
one.
proffer the amendment?
I have a motion and a second. Senator Reedy, question?
Just a question or a comment. I'm not against someone from it's Morgan, right? That is the School of Health. That's the HBCU at the School of Health, or are there multiple HBCU School of Health in the state? I thought it was just Morgan.
That's what council said. I know that there are other HBCUs that have health programs. I don't know if it's a public health. Senator Lamb?
The bill says a program of public health. So technically, I think Bowie has a program of public health in IT. So, I guess there could be a faculty member who's in that public health IT program at Bowie, for example.
I guess my thought would be they're on the commission, right?
Yes.
But there's an HBCU representative on the commission and they
Not
could be
yet. We
eligible.
No,
haven't
they
adopted.
are. I think it came over.
Did it come in the amendment?
I thought
We
I saw
just
that.
made that one of
Yeah.
the leaders.
So the commission includes a faculty member. I can say it. It's a faculty member from a public health program at a historically Black college or university. And the question is whether this particular person will be one of the co-chairs.
For sure. It could be anything, right?
Could be.
That's under his-
Senator Hershey.
Again, maybe following up on what I mentioned earlier about, again, my thoughts on somebody that has experience in the field. What if we did the local health officer was the chair and the academic leaders were three co-chairs? Well, we're going to get to four anyways if we take this vote, I think.
So basically, the question is whether or not we want to specify that the co-chairs are a local health officer, a public health faculty from a major institution, and a public health leader from an HBCU. So those could be the three that we define.
Isn't that what we have? That's right now?
No, we're being more specific to say one of the three would be HBCU, whereas yours could have Maryland and Hopkins and the health officer from Calvert. Right,
So we're saying health officer,
and
HBCU, and one of the two.
correct.
The reason I left it up to two out of the three kind of schools of public health, so to speak,
Mhm.
is that Morgan's school is much smaller. So the number of faculty that are there
Mhm.
are much smaller compared to some of the other schools. It's also focused a little bit differently. I don't know if they have the expertise, and nobody's reached out to Morgan either as part of this. But I haven't reached out to Morgan to check to see if they're interested or open to it. The other two institutions submitted supportive testimony.
Mhm.
So I wanted to leave that option for if Morgan wanted to participate, they could certainly put their name into the hat. But I don't know if they actually are interested or supportive or not.
Not to burn up a lot of time and debate, but in fact, I think not knowing the size and having two that aren't exactly the same is actually better, so that there's a different perspective. Both are training public health professionals and preparing them to work in communities. So having two equally positioned ideological peers that work with the same student population may not offer the diversity to the group that having an HBCU leader would. But I don't want to exhaust the committee on this. I've had so many conversations about this Public Health Commission. It should not be this complicated to put together a group of people to address the kinds of things that are in this bill. So I don't want to exhaust the committee on this. I'll go to Senator Ellis.
Yeah, thank you, Madam Chair. Very important issue. I'm just asking a question. Could we hold this bill and reach out to Morgan and have those questions answered?
I mean, we could. Just for the committee's benefit, I have had a conversation with Bowie State University, and they are interested in participating and being represented on commission, so. Yeah. It could be Bowie, it could be Morgan.
So the recommendation I heard is we could just say, include amendment in a HBCU. And it could be whichever one that is. Coach. Yes. Since Bowie was interested.
Okay, that is the motion and the second,
Thank
but
you.
I'll go to Senator Lamb. Did you want to speak again to that motion?
Can you just clarify the motion? Sorry.
So the motion is that there would be a representative from an academic institution with a public health program, a representative from a HBCU, whatever the language is, and then a local health officer as the chairs of the Public Health Commission. That's the motion that has been seconded. Any questions?
Does that undo the previous motion then? Is
It would amend Senator Lamb's motion,
the previous?
correct? Any questions? All those in favor of this new motion about the leadership of this Public Health Commission, please raise your hand. Okay, that receives unanimous support. And by the way, this is still going to have to go back over to the House and be worked out. So it may come back looking even different yet again. All right, the second difference, Senator Lamb, with your amendments?
The second difference has it staffed rather than by volunteer staff of the schools of public health. to have it staffed with DLS and with the support of MDH.
So well, I'm just saying I didn't have the benefit of hearing from DLS that they were willing to staff this. I know we give them a lot of responsibilities during the interim and would be concerned, but I know you've spoken with someone. Senator Hershey?
I just would rather see DLS do it than volunteers do it. 529. But volunteers.
What?
Senator Lamb?
And when I spoke to Vicky, she said that they could also accept volunteer help from the institutions
Yeah.
too, without the need for added language in there. So. Right.
So
Well,
Senator Lamb has an amendment that would have DLS staff the commission. Sounds like Senator Hershey seconded that.
Yes, ma'am.
Any questions? All those in favor of that amendment, raise your hand. 1, 2, 3, 4, 5. That's, okay, that's unanimous. Even though I'm not, I'm doing like rounds.
We have to get you the vote.
No, I don't want the thing. Okay. What was the other difference?
So the third would be to have and this would go along with the fact that DLS is staffing it, you would have members of the General Assembly on the commission.
Raise their hands first is on it.
I think Senator Lamb, I nominate Senator.
So do I. Second.
Writing the report for DLS.
I'll second that.
A senator who is from Howard and Anne Arundel County.
Who happens to be a medical doctor with a background in public health
Yes.
and serves on the committee of jurisdiction to whom the report will be distributed. I have a motion and a second to add members of the General Assembly, one each representing the House and Senate to this commission. All those in favor, raise your hand. To appoint Senator Lamb to the, okay, that's a unanimous. Oh, yes, Senator, be sure. Oh, yes. That's unanimous. You now have before you, that was,
There's one more difference.
what is that?
It has to do with the way that the work groups are going to be structured.
Oh, I'm gonna resist on that. I think the bill came in with work groups that the chair of HGO had very clear direction and, stuff in mind, and I would like to support that, the work groups that they defined.
Can we make all these members subject to Senate confirmation? Please.
Okay, so we're gonna not vote, take up that last amendment. We're gonna move the bill you have before you 214 as amended. Any questions? All those in favor, raise your hand. 214 as amended has received unanimous support. Next bill, please. Whew.
Okay. Okay, so this was a bill that was heard yesterday, and we heard two PBM bills, and two of them are on the voting list for today. The first one, we heard three PBM bills yesterday. Two of them are on the voting list. This is House Bill 374. This bill is the one that establishes requirements and restrictions on PBMs during the pharmacy audit process. Among other requirements and limitations, the bill would prevent a PBM from looking at a pharmacy's bank records, credit card receipts, or data as it relates to cost sharing, limits the number of prescriptions that may be audited during a desk or site audit, and requires a PBM to provide a pharmacy or pharmacist being audited with a phone number and, if available, access to a secure portal that may be used to ask questions regarding the audit. Under the bill, a PBM by October 1st, 2025 has to provide a mechanism for secure electronic communication and the submission of documents to the auditing entity. The bill also requires the Secretary of Health to adopt regulations for PBMs that contract with managed care organizations that establish requirements for conducting audits. So you've got a reprint in front of you that would that the chair is offering that would limit the application of the requirements and limitations on audits to PBMs to PBMs that provide pharmacy benefit management services on behalf of a carrier. So that's the current limitation in law. And the big objection yesterday was that the bill as it came in would apply this not just to carriers, but to the self-funded plans that are subject to regulation under federal ERISA law. And so that was the main objection to the bill. The rest of it, which I just listed, was the product of negotiations between the PBMs, the carriers, and the pharmacists. So the amendment would limit it to carriers. That's the amendment.
I have a motion and a second for a favorable on the bill and the amendments. Are there any questions? All those in favor, raise your hand. Unanimous favorable with amendments report. Next bill.
House Bill 382, the other PBM bill, is an emergency bill. It requires the Maryland Department of Health and the Prescription Drug Affordability Board to jointly study the total amount that Medicaid MCOs paid pharmacies for prescription drug claims in calendar 21 and 2022, what the total amount paid to pharmacies would have been if claims had been reimbursed at Medicaid fee-for-service rates, and how to address the inconsistency between these amounts by considering the total cost to the state and recommending a methodology for determining the most accurate ingredient cost of a drug and an appropriate dispensing fee. No amendments offered on this one.
Second.
Motion and second for a favorable. Senator Bidle.
Madam Chair, someone asked me, where do the MCOs stand on this bill? And I don't know that answer. I haven't talked with any of the MCOs.
They think they just submitted a letter of information.
So they apparently not opposed.
They didn't weigh in opposed to the
Thank you.
study.
Okay, have a motion and a second for a favorable. Are there any questions? All those in favor, raise your hand. That bill receives a unanimous favorable report. Move to the next bill, please.
Alcoholic beverage bill from Carroll County. This is a bill that's similar to Senate Bill 393, which the Senate passed earlier this session. This alters the residency requirement for an alcoholic beverages license on behalf of a partnership, corporation, or club, or LLC in Carroll County. The House just made some. The House just there's no amendments, but the House, just to know, the House did change the bill, just doing some different stylistic drafting to the bill.
Second.
Motion and a second for a favorable on this Carroll County delegation bill. All those in favor, raise your hand with the stylistic changes. All right. Was that unanimous? I couldn't see. Some people are texting. Can I get all those in favor of the Carroll County bill? Please raise your hand. Okay, that's unanimous.
The next bill is a Baltimore City alcoholic beverages bill. I did get a letter today from the delegation that approved some amendments that were put on the Senate bill. But the amendments looked a little different than what was adopted on the floor. So I think we just need to hold this to get some clarification on the position of the delegation on this. And this is the 587. Yeah, it's has to do with the addition of that amendment relating to Cross Keys Marketplace. Yeah, okay. And then actually, Senator Hayes, I did speak with you about this, and I don't have a letter from the delegation, but this is the next one is House Bill 885. This has to do with the Central Intercollegiate Athletic Association basketball tournament. And so I don't have a letter for this one yet from the delegation. Okay. Do you want me to present the bill now, or? Okay. House Bill 917. This is Baltimore City Alcoholic Beverages Bill. This is similar to Senate Bill 607, which the Senate passed earlier this session. For this, I do have a letter. The bill alters provisions of the alcoholic beverages laws in Baltimore City, specifically relating to the 46th Alcoholic Beverages District. There are some amendments that are reflected in the reprint. Generally, they clarify that a certain restaurant has to have a physical duck pin bowling alley, authorizes restaurants located in certain areas to obtain a Class B beer, wine, and liquor license if the restaurants meet certain requirements, and allows an additional establishment to convert a Class D beer and light wine license to a Class D beer, wine, and liquor license. The amendments also extend the expiration date of licenses issued for certain premises so they can be renewed or transferred to a new owner. And then the amendments, there are amendments to a Baltimore City charter provision relating to the Downtown Commercial District Management Authority and the policing of the block to allow the Baltimore Police Department to fill additional deployment shifts using police officers and other law enforcement agencies.
Okay, we have a House Bill 917 before us. Is there any discussion with amendments? I have a motion and a second for a favorable on House Bill 917 with the amendments that were just described. Any questions? All those in favor, raise your hand. That bill receives a unanimous favorable report. Next bill.
House Bill 1063 is similar to Senate Bill 654, which the Senate passed earlier. It establishes 6-day and 7-day class health club beer and wine licenses in Harford County. The House altered qualifications for a license so that a health club facility must offer an indoor or outdoor swimming pool or pickleball courts.
Oh,
The
wow.
House also adopted a requirement that a license holder purchase beer and wine from an authorized and licensed wholesaler.
Adopt the indoor outdoor pool and pickleball.
Yes, and the senators have submitted a letter supporting those amendments.
Those additions.
Yeah, those additions, yes.
Okay, that made it very specific to one club.
Motion and a second for a favorable on House Bill 1063. Seeing no questions. All those in favor, raise your hand. Unanimous favorable report. Next bill, please.
Moving to Howard County, this is House Bill 146. This removes a requirement that the Howard County Board of License Commissioners hold a hearing for a license holder applying for a change of resident agent when the applicant is seeking to be a resident agent for the same license for which the applicant is a license holder and has previously appeared and been approved at a non-violation hearing for the same license before the board or the appointed alcoholic beverages hearing board. It also allows the board to hold a public hearing for a change of resident agent if the board determines that there is good cause. Letter in support of the senators for this bill.
Motion and a second for a favorable as amended? No
Favorable.
amendments,
No
just a
amendments.
favorable. Seeing no questions, all those in favor, raise your hand. Unanimous favorable report. Next bill.
Another Howard County bill, House Bill 158 allows an individual who's a resident of the state to meet the residency requirements for an alcoholic beverages license application in Howard County. It also makes relating conforming changes, including changes to the required information on a license application. No amendments for this one.
Senator Bidle, sorry.
Letters from the senators, even though this is only a House delegation bill, do our senators get to agree and have they?
Mhm. Yes.
Thank you.
Senator Lamb.
The Senate delegation chair, I can explain. So the Howard County delegation meets together as a House and Senate convening together at once. And so when we take votes on legislation, we vote on them together. So it comes, and then by tradition, we file it usually in the House first. So the vast majority of our bills are just filed through the House and they come through the process.
All right, have a motion and a second for the favorable.
Favorable.
Thank you. Motion and a second for a favorable on the bill without amendments. Any questions? All those in favor, raise your hand. Unanimous favorable report. Next bill.
Another Howard County bill, House Bill 218, repeals the requirement that alcoholic beverage license applicants in Howard County include a petition of support containing certain information as part of an alcoholic beverages license application. Also makes a technical change to preserve the ability of the Board of License Commissioners to waive the residency requirement for an applicant under certain circumstances. No amendments for this one.
Motion and second for a favorable on House Bill 218. Seeing no questions, all those in favor, raise your hand. It's unanimous with 10 votes. Favorable report. Next bill.
House Bill 644, this is a Frederick County bill, establishes a Class B GSF or golf simulator facility, alcohol beverages license in Frederick County, and authorizes the County Board of License Commissioners to issue a license for use by a golf simulator facility that meets certain requirements. License authorizes the licensee to sell beer, wine, and liquor for on-premise consumption, as long as the licensee offers food on site at all times when alcoholic beverages are being sold. No amendments on this one.
Motion and a second for a favorable on the golf simulator facility license, Frederick County 644. Seeing no questions, all those in favor, raise your hand. Unanimous favorable report. Next bill.
House Bill 679, a Frederick County bill, exempts an alcoholic beverage license holder in the county from the statewide requirement that a license be framed under glass, and instead merely requires that a license be framed and displayed conspicuously in the licensed premises. No amendments.
Have a motion and a second for a favorable. Seeing no questions, raise your hand if you're in favor. Unanimous favorable report. Next bill.
House Bill 939, a Frederick County bill, extends the Sunday hours of sale for certain alcoholic beverages licenses in the county. For most of the licenses specified in the bill, the modified Sunday hours of sale mirror the existing hours of sale for the other 6 days of the week. No amendments for this bill.
Motion and second for a favorable House Bill 939. All those in favor, raise your hand. The unanimous favorable report. Next bill.
Frederick County, again, House Bill 989. This establishes a Class B MGC miniature golf course beer, wine, and liquor license in the county and authorizes the Board of License Commissioners to issue the license for use at a miniature golf course that meets certain requirements. There are no amendments to this one.
Motion and second for a favorable mini golf license. All those in favor, raise your hand. Unanimous favorable report. Next bill.
And House Bill 990, I think there was a request to hold this, just some additional questions that come up. House Bill 991, a Frederick County bill, repeals the restriction that an alcoholic beverages licensee in the county who's been issued a basket of cheer permit may only provide a basket of cheer containing alcoholic beverages if the alcoholic beverages were produced in Maryland. No amendments for this.
Motion and a second for a favorable on the Maryland only basket of cheer. All those in favor, raise your hand. I don't get it, but it's their local bill.
Please don't ask me to explain, because I can't exactly remember, but we have to ask.
Okay,
Okay.
Can I ask the question?
unanimous.
I'm sorry.
Sure.
About the previous bill that was held, and I'm sorry I'm asking it after it's been held. Did somebody ask to hold it? Or
I did.
Oh,
I
okay,
want to
all
look at both the hatchet bills.
You're the boss.
Looking at-
Understood.
There's
Checking.
some hatchet questions.
That's answering the question. It sounds like we can all-
We can chat offline. Yeah, yeah. Yes.
Okay, so the next bill, House Bill 997, Frederick County bill, alters how an individual on the licensed premises of either a beer and wine consumption permit holder or a beer, wine, and liquor consumption permit holder may consume alcoholic beverages. Under the bill, an individual covered by a beer and wine consumption permit may choose to consume either a single serving consisting of 12 ounces of beer or 6 total ounces of wine, or 3 individual servings of beer or wine in any combination, each consisting of up to 2 ounces of beer or 1 ounce of wine. And then similarly, an individual who's under a beer, wine, and liquor consumption permit may elect to consume a single serving. It's the same concept.
What are the consumption?
What is,
So a consumption permit is an additional authorization that a licensed premises would have that allow individuals to consume their beverages on site when they purchase them. And so there are current limitations on how many of these beverages can be consumed on site. So before it was just, for the beer, it would be, 1 12-ounce beer, but now they're saying they want to be able to allow someone instead to consume like 3 flutes,
Right.
of 2 ounces of beer each, which is substantially the same as the one beverage.
I think it's similar to beer tasting type of thing, right?
Right.
But it can occur in a liquor store or
Yes,
something like that, rather than
exactly.
in a restaurant.
Correct.
Right.
okay, we have
See, 23.
997. No amendments?
No amendments.
Motion and a second for a favorable. All those in favor, raise your hand. Senator from Baltimore, you with us? Okay, that's a unanimous favorable report. Next bill?
House Bill 1058, this one holding for questions, and then House Bill 1062 is the next one.
Okay,
House Bill 1062, Hartford County Bill increases from 3,000 to 4,000 individuals, the quota used by the County Board of Licensed Commissioners when issuing certain Class A licenses, and reduces the number of Class A licenses that the board may issue from 3 to 1 under that quota.
Senator Ellis.
What was the quote again, that number you put out there? please?
Yeah, so it's for every 4,000, it would be for every 4,000 individuals, 1 license.
4,000 individuals, is that license, that's population based?
Correct.
The county?
That's my
Okay,
understanding of how it works.
great, thank you.
Okay, I had a motion and a second for a favorable on House Bill 1062. Seeing no further questions, all those in favor, raise your hand. Unanimous favorable report. And one last one thank you, Patrick. One last one from David.
Yes. This is a withdrawal. This is Senate Bill 284 and involves collective bargaining rights for the employees of the Walters Art Gallery. The sponsor would like the bill to be withdrawn.
Have a motion
Favorable to the withdrawal.
and a second for a favorable to the unfavorable. Senator Vital, did you have a question?
I do have,
They worked it out.
oh, they were,
Yeah, there.
All right, all those in favor of the unfavorable, raise your hand. That's unanimous.
And there's one more. You've got to, even though there's a letter for withdrawal written to the Appropriations Committee. However, the House bill happens to be here in the Finance Committee. So I'm not sure how this works, but just in case, if you want to vote.
Can I get a
similar to
motion and a
withdraw.
second on the unfavorable withdrawn for the House cross file of that same bill? All those in favor, thank you, Senator Hershey, Senator Vital. On the first and second, okay, all those in favor, raise your hand. It's a unanimous unfavorable.
And for Tammy's purposes, that's a House Bill 116.
Thank you. Okay, thank you all very much. It's been a tough week. We stayed longer than we planned to today. Please plan to be back by 2:45 on Monday. I'll text you if the time changes. But the reason is we have executive noms at 4. There's some delegations that are doing some voting on Monday. And some other meetings happening, but as you all know, Nathan isn't here. And so we had some bills of his that we might have voted yesterday or today. So if I find out we can do it later, I'll text you. But at this time, yep, that's what I'd like to ask you to plan to be in town by 2:45. Questions? Have a great weekend. Be safe. Thank you.